You guys can't look at me.
Oh, what are we supposed to do?
Just like,
I know. It's like this.
hi, welcome. I am here with Dana Ramsey and Beth Dorsey, who are two co-owners for a health center, Points for Wellness and Nurture, right?
That's right.
Tell us about your practice.
Well, I'm Beth Dorsey, and I'm an acupuncturist, and
She's a doctor.
yes,
Dr. Beth.
Dr. Beth Dorsey. I am an acupuncturist and functional medicine practitioner. We both specialize in women's health and fertility, and also digestive health and pain and stress and all the things. But my main passion is working with women who are going through lots of hormonal transitions and just really supporting them and helping them, answering all the questions and getting through all the transitions.
Dana, tell us about you.
I'm Dana Ramsey. I'm a certified nurse midwife and women's health practitioner. I've been practicing here in Santa Cruz for about 13 years now. 2 years ago, I left corporate medicine to start my own practice. I am the Western medicine part of our clinic here with an integrative medicine flair, working mostly with women with fertility, hormonal imbalances like PCOS and endometriosis, and I do a lot of menopausal work as well.
Basically, Dana and I have known each other over the years. Obviously, she worked at PAMP and I worked in my private practice and have referred to each other over the years, and I've always heard so many amazing things about Dana. And so actually, when I was getting my doctorate for Chinese medicine, I ended up needing to do some shadowing hours with a biomedical practitioner. So I immediately reached out to Dana, who had started her own practice, and what she was starting, I was like, yes, we need that in this community. And so I made sure that we got together, and when we did, we just hit it off.
Mm-hmm.
And then when we were talking, it was just like, it'd be so amazing if we could practice together.
Yeah.
And at that time, it wasn't quite the right time, but then a few months later, we came together and it was the perfect time, and we both just jumped in with both feet.
Yeah, and then the universe just took over and doors just started to open, and I couldn't be more pleased to collaborate with such a brilliant woman.
Same.
And such just a wonderful spirit. And we share a lot of patients. So patients who come to me that have never tried acupuncture are now afforded the opportunity in the same office to get acupuncture and Chinese medicine. And patients who maybe haven't gone the Western medicine route yet with their journey are able to see us, and we're able to collaborate really easily and seamlessly to get them the best care and the best outcome.
But I didn't know that it was you. She said, I have a surprise in the works. And then like the announcement, I think on like Facebook or something,
Yeah.
I was like, WTF,
I
you
know.
and Dana?
I know, I think we just hadn't like opened our doors yet and
Yeah.
everything, and all the, we hadn't
All the
done all the
details.
things yet. Almost 1 year.
Yeah.
June 1st will be 1 year, which has
Ooh.
just flown
We have to have an
by.
anniversary party.
I know, we
No.
still, due to COVID, haven't even had the
Oh, your grand
grand
opening.
opening.
yeah, we haven't
We
had
should
our
get-
ribbon cutting, we
Yes!
haven't
I
done
know.
all the things.
Can we do them?
Yes.
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 You had mentioned that we need in Santa Cruz community something as what Dana does or is doing. Can you elaborate on what it is that we need and what Dana specializes in?
So Dana obviously does women's health and fertility, and the beautiful thing that she does is she offers kind of an in-between what they can offer here in Santa Cruz for fertility and then over the hill for IVF. And in my opinion, there's
What's
a good
IVF?
IVF is in vitro fertilization. So there's an in-between. What's offered here is kind of basic, and then when it gets a little bit more complicated, they generally refer people over the hill to PAMP over the hill. But there's a nice in-between, and Dana is able to offer that, where she can help with hormone balancing, but she can also help with some assisted reproductive technologies like IUI, which is intrauterine inception. She has all the tools like ultrasounds to really monitor the patients and see how they're responding to some of the medications. And it's just so wonderful because it's just like a lot more patient care. So for me, I send patients to Dana that are ready for that next step in fertility, and also with general health care. Like, she can do your regular gynecological exams and care. But so when somebody is ready to just, a lot of people come in and they just want to get pregnant naturally, but some people need more help and are ready for more help, and that next step is just a natural step to go with Dana.
Yeah, and I think a lot of my patients who haven't necessarily taken the step towards integrative medicine or Chinese medicine, I think they aren't really educated on other things outside of just traditional Western medicine. And so being able to partner with patients with Beth allows them to complement what we're doing from the Western medicine workup and treatment, and allows her to really focus on a lot of the nutrition, a lot of the lifestyle, a lot of the energy work, and then also add herbs into the picture.
Yes, and then Dana can also offer more of a thorough Western medicine, diagnostics, and really together we can just really help them achieve their goals.
Yeah. That's really cool. So what would you say is your biggest win together as like triplets?
Well, we've had a lot of success with patients getting pregnant.
Yes.
I love practicing collaboratively with other providers, and Beth is been just a dream to collaborate with. I feel like we connect really well with patients, and so our patients are looking to have that connection straight off the bat, and so that's really nice because we do that nicely. But we're able to take a different approach that's just complementary to what each of our specialties are. And so it really gives a holistic and well-rounded plan for these patients who are dealing with something that's hard.
Yes.
And between Beth and myself, we are able to really address all the aspects of health that they need, and if they need to go on to further care, because that definitely does happen sometimes, we're able to support them through those big decisions that they need to make here locally where they live. And so that makes it, I think, really helpful.
Yes. And oftentimes we'll have a patient and they have some questions that they need answered that they might be seeing me at the time, but that question really is for Dana, or they're newly pregnant or something that we need to figure out. And it's nice because I can generally pop over and ask Dana a question, and we can help them right then and there together. And so they just really, really feel cared for.
I think that's really cool that you guys are able to kind of calm your patients and give them that support.
Yes.
I mean, I think that in addition to doing specializing in fertility, we also have a big toolbox for helping women in other hormonal journeys. So a lot of our patients are perimenopausal in those late 30s, early 40s, where they're just experiencing a lot of ups and downs, and I think they also need some extra TLC around that time, because the teens and the decade of the 40s are both can be really challenging hormonal times.
How did you get into this line of work?
So I was very young, right out of undergrad, and I went off to Yale University where I got my master's in nursing with a specialty in women's health and midwifery. And so I was delivering babies in my late 20s.
Whoa.
I know. I was pretty driven. Between Kaiser and the Palo Alto Medical Foundation and a couple private practices along the way, I really was able to pick and choose what about those practices or those foundations really was helpful to patients and what was not helpful. And so, in my nearly 20-year career as a midwife, putting this clinic together and really kind of cherry picking all of the things that I knew would make women feel more supported, would make them feel more comfortable, Beth and I were able to integrate into this clinic.
That's cool. Are you still delivering babies?
I'm not delivering babies right now, so that was one thing that I did give up 2 years ago when I left the Palo Alto Medical Foundation.
Do you miss it?
I miss the connection with patients and seeing them over a long period of time, but I really realized that I needed to sleep more.
Oh, yeah.
Yeah, I had not slept in 15 years.
Oh, wow.
And so the last 2 years
welcome
have
to
been
the world.
Amazing.
Yeah.
Because I haven't slept since I was about 25.
Wow. Wow. You're going to need some support.
Yeah, exactly. Yes.
Yeah. We gotta get you in.
We do.
Yeah. basically, I was living in Tahoe. I used to be a massage therapist, and then Jeff, my husband, compound fractured his femur skiing, and so he started going, and he had all this recovery to do, and then he was going to go have another surgery for it, which they wanted to do a bone graft, and he had been getting acupuncture and getting a lot of acupuncture. And right in his pre-op, he said, I want you to go ahead and do another x-ray and make sure that I actually need the surgery. And the doc was like, you need it. And he's like, just do the x-ray. And he did it, and he's like, you're good to go. You can leave. I got to see how powerful it was. So I knew I wanted to do more than just massage. And so I was looking, and I liked working on pain, and I liked working on athletes up there. And so the thing that drew me to acupuncture was that you could do internal medicine and do pain. So I was like, cool, I can do my pain stuff, but then I'm really intrigued with the herbs and the internal medicine component. And then when I was in school, I read the book, The Infertility Cure by Randine Lewis, and then I was hooked on like women's health and hormones.
So how do you seamlessly integrate like herbs with acupuncture?
It kind of depends on the case. In Chinese medicine, is all about getting after the root cause. And it's all about finding the root imbalance. And a lot of the diagnosing is through feeling the pulse and looking at the tongue. So once you find your Chinese medical diagnosis, then you can apply an herbal formula / remedy to that. And if you keep working on that constitutional imbalance, the symptoms start to go away. Whereas Western medicine can be more of a symptom-based approach. Like, okay, you have this symptom, let me give you this med. But when you peel that back, if the root imbalance is still there, then nothing's really been fixed.
Right.
It's more of a Band-Aid.
It's more of a Band-Aid. Yeah, it's been, whatever's been bothering the person is alleviated. But temporarily. But I do a lot in the fertility because I do a lot with certain phases of their cycles. If they're in the follicular phase or the luteal phase or on their periods, there's a lot of different formulas I like to use.
Has there been like one experience or like treatment that you're just like, holy cow, I can't believe that like that worked? Like that just like kind of was like surprising.
A lot of times in that menopausal phase, people come in and they are miserable.
Yeah.
They're like at their wit's end. They are miserable. They are not sleeping. They feel like crap, and they're just feel terrible. And so I'm like, okay, here. And I feel like too, if we can get people into that parasympathetic, relaxed mode, then they can heal. The body's designed to heal itself.
Yeah. Yep.
I'm just here to help facilitate that.
Yeah.
So by putting the needles into people, it helps get them in, and then leave them for quiet for half an hour. I mean, I'm literally kind of like, fill you up. Let's resource you so that you can function.
Yeah.
Sometimes when these women come in that are miserable, and I give them some herbs, I give them some acupuncture, and I'm like, and
super scientific.
And a lot of them, but recently one's like, I feel so much better. And it was some simple things, some herbs, maybe some supplements, some lifestyle suggestions. They had the bandwidth to do it. They did it. Not everybody does the things. She did it. She was motivated. And she's like, it's actually unbelievable to me.
Wow.
And every once in a while I'm like, oh, sometimes it is to me too,
Yeah, women are such caretakers to their family. And so I think when they come here, they feel really cared for and wrapped around. And I think it's looking at the whole person. And sometimes it's just meeting with Beth or meeting with me, and it just turns a switch and they go, yeah, I need to take care of this, and I need to get to the root cause and put myself as a priority.
Yeah, and Dana spends an hour. I mean, her initial visits are an entire hour, and that's
unheard of.
That's unheard of.
Like talking, like asking questions, taking charts, physical.
Yeah, I basically spend 45 minutes to an hour with every single patient.
That's incredible.
Throughout the day. So I went from seeing about 20 patients a day in corporate medicine to seeing 8.
Wow.
And it is so enjoyable to offer that kind of a care.
Yeah.
Because you really can get beyond just the surface problems and throwing Band-Aids at problems and really get to the root cause. And about 4 years ago, I did integrative medicine training, and so I really got to understand how important getting to the root cause of problems is. That's where I think her and I shine really well, because we talk the same talk, and we have the same goals, and so we can work together.
The biggest win has been Dana. Like, I swear to God, like
I agree
have there been any challenges? No.
Well,
I mean,
Dana was like,
really.
the universe just kept opening
It
our
did.
doors. It was like, this is where you're meant to
It
be.
really
Yeah.
did. I
Yeah.
couldn't have ever wished
Yeah.
upon a better
Yeah.
person to do this with.
Yes.
And even like a year and a half into it,
Yes.
like I wholeheartedly, it
Yes.
gives me goosebumps.
Same.
Could not have picked a better person.
Same.
And we hadn't met until
Yeah.
like the middle of the first year of the pandemic.
Yeah.
So it's not like we had been buddy
Yeah.
buddy. We had shared patients.
Yeah, but we didn't know each other.
We met up at Blue Ball Park
Yeah.
on a foggy day with
Yeah.
our beanies and
Yeah.
our cup of tea. And we kind of just like clicked.
Yes.
And we had a bunch of patients in common.
Yes.
And over like the course of about, I don't know, 4 or 5 months,
Yeah.
we just started to talk more and this kind of blossomed.
I just got the chills. That's so cool.
Well, I know, and then even before we got in here, we would get together and we would talk about all these things we needed to figure out, all these topics, all the
hard conversations.
conversations, long walks, and at the end we were just like, cool, we got that, and it just works, and it still does.
It still does.
And so I don't feel like there has been a lot of challenges. I mean,
And any challenge that we've had, it will work itself out.
Yeah.
That's like what Beth says. It's gonna work itself out.
it's workable.
It's workable. It's workoutable.
So we have Dr. Zandra Amato. She's a chiropractor and she's been in practice forever. Her and I used to share a practice down the street, and she's amazing. And we're so happy that she joined us here. And then we also have 2 wonderful massage therapists.
Yeah.
And they've been amazing. And so that's been really great because people can kind of come here and get all the things that they're looking for.
Yeah. We also do aesthetics.
Yes.
So we do medical aesthetics. So for women who want to do skincare, Botox, resurfacing, we have that available as well.
And all of this to say that this isn't like a us against
Yeah.
Western medicine
No.
or anything like
We're
that.
not
Because
kidding. We're not
everybody because we love to work very collaboratively with all the other OB-GYNs and midwives in town, and they
it's
do.
added. It's extra.
Yeah,
That's not
exactly.
working. Let's try this.
Yes,
Yeah.
that's right. That's right.
Absolutely.
I've never ever think that my medicine is the only medicine.
Right.
You know,
Exactly.
So,
Yeah.
mhm.
There's many different ways to provide care, and we just offer one way, but all of the ways are valuable.
Yes.
Yeah, it's really nice to be surrounded by women practitioners here. I think it really does make a difference to be caring for women by women.
Yeah, it feels really good to be working with a lot of other just strong, smart, successful, entrepreneurial women.
Yeah.
Come on, let's go.
Come on.
Up to Dana.
I'm going to pay you.
You want Botox?
Yeah,
Do you
right
really
now.
want
I've never
some?
done it before.
Oh my gosh, are
I'll
you
take-
sure?
Yeah, we're going to do it on video.
I
Okay.
want a refresher.
Okay. Let's do it.
Should I be excited or nervous?
Excited.
You should be excited.
You're gonna be stoked.
Frown? Oh yeah.
Oh yeah. Oh yeah, you got wrinkles.
Frown, frown, frown.
Nice frown.
Surprise? Keep going. Yeah, you don't have to open your mouth.
Oh. She's like,
I can't talk while I do this.
No.
You feel? Well, I'm very excited. I know that I'm in good hands. Dana's amazing. And Beth told me that she got some, but I couldn't tell. She just looked good. So I trust Dana explicitly with my moneymaker. I mean, my face.
Are you ready?
Yeah.
So it's just gonna feel like little pinpricks.
Okay, should I close my eyes
Close
or
your eyes.
do anything? Okay.
Okay, just relax. 1, 2, 3, prick. Last one.
And I hate needles.
1, 2, 3, prick. Done.
Yay!
So we did it. It's an adventure
I know, right?
when you come hang out with Shamika. It's an adventure.
My favorite joke is whenever I see Beth and Dana on like Instagram or something, it's like, oh, we just got somebody pregnant and they're coming out of the lab. Like, how many women does it take to get one woman pregnant? A few. There's never a man in the room
Never.
with you guys.
No.
Yeah, that's right.
Good job.
messed
All the things.
You did so good.
Yes, you did.